Seriously with Martin Bester.
On a Wednesday, we do Good Morning Angels. Today, it's different. It's Women's Month. We're helping out where we can with our very generous angels. And there's more than one angel coming forward this morning. This next story is the story of 26-year-old Miss X. She finished her foundation phase teaching degree, is currently a trainee teacher, pursuing her dream. But she's, however, also living with a lot of pain. She'll tell you more about it in Good Morning Angels Bumper Edition Wednesday.
Jacaranda FM's Good Morning Angels. Wednesdays on Breakfast with Martin Bester.
I've struggled with heavy and painful periods since my high school days. At first, I thought it was normal, but as time went on, the symptoms worsened and I began to experience other issues like pelvic pain and bloating. And I've always wondered why my friends got their periods for 3 days while mine lasted for 7 days. So I remember one day, over 5 years ago, I was experiencing the worst and most painful period pain of my life. The cramps were excruciating and I felt like I was losing control. The pain was so intense. I remember I couldn't move, I couldn't think, and I couldn't escape the feeling of being completely overwhelmed by my own body. After a few visits with my gynecologist, he then noticed that the cysts were growing in size and that this was a very serious matter that needed to be dealt with. And he said, by the look of things, it has to be endometriosis. The doctor noticed that the endometriosis has spread to the bowel, which is also a call for concern, My hopes after the surgery are to be relieved from pelvic pain, because right now I'm currently a student teacher and I do not want to miss work every other week or leave work early just because I'm in pain.
It's debilitating. I can only imagine.
I think for a lot of women, there is this perception, or we are told generally by other women, that that's just kind of what you go through. Every month you're just in pain, kind of suck it up, take some pain pills, use something and get on with it. And we do. But it's not supposed to affect your life where you literally can't go to work, where you are dizzy, it's not supposed to be like that.
So you're saying you're made to think that you should expect pain.
Absolutely.
And then you don't know what level of pain is normal.
Absolutely.
And what is not normal.
Yeah.
And then a lot of women would be just living and working with this pain, not knowing that it's normal or abnormal.
Absolutely. And it's years, because obviously, most women start their period, let's say at the age of 13, 14, let's say, up until the age of 45, 55, whatever. So it's years of just living with this terrible pain going, that's just how it is.
Well, here to tell us more about this is specialist doctor and gynecologist, Dr. Aubrey de Bruin. Dr. Aubrey, thank you very much for your time. I know you've got a lot to do in a day, and I appreciate your time here.
Thanks, Martin. Just to correct that, period starting at 13 to 14, it's gone down to 10 now.
Oh, wow.
So we've now increased the number of years that people have pain.
Yay.
And in the world, the time it takes from a patient presenting to a doctor to when the diagnosis is made has come down from 12 years to 10 years.
Sure.
What do you mean by that?
So when a patient presents to the doctor and says, listen, I have painful periods, until someone makes a diagnosis and say, you actually have endometriosis, it's now amazingly come down from 12 years to now only 10 years. So it takes 10 years from when people present to when we get a diagnosis. So you can imagine what that disease does in 10 years.
Yeah, every month, 10 years.
Make me understand more about the disease. Is it often misdiagnosed? Is it not diagnosed? Do people not, obviously it takes them too long to come forward?
There are a couple of issues. The first issue is it takes long for them to come forward because they're told it's okay, like exactly what you said. It's okay, you have to have painful periods. No, you shouldn't. So we want to do a drive at the high schools to meet with all the girls and the mothers and say, listen, this is not normal. Secondly is you can't see the disease. But what the disease is those cells that a woman menstruate out every month when that starts growing on your inside and you can't see it. So there's only certain types of endometriosis that you can see on an ultrasound, but the ones that cause most of these issues you can't see on an ultrasound. So that's why you have ultrasounds, you have x-rays, you have pain tablets, you have this and that, and then the pain tablets causes constipation, and then you have more pain. So there's symptoms, and people miss the symptoms because when we train, the biggest portion of our patients present with a certain disease, and we get told that young girls don't get endometriosis, and they shouldn't get a laparoscopy, and they shouldn't be examined, and they shouldn't go on the pill because and all these things are taught, and then no one wants to actually listen and actually do something and say, listen, but this is not normal.
Yeah, and this is affecting quality of life as well.
I can imagine,
you know what I mean?
for goodness sake.
Yeah.
So there's a huge process of education that needs to take place.
Yeah.
At school level.
At school level, firstly, and then secondly at university level, at training level. We should go away from saying that everyone that presents with pain has an infection. No, there's lots of other things that can cause pain, and endometriosis is such a huge disease, and it's, in my opinion, it's a benign cancer. It eats you up from the inside, and it destroys your quality of life.
Why is there not a training course for parents? Never mind.
Good question.
Well, I mean, can I step in there? And you said something which I find very helpful, that, the attempt to talk to kids at schools, parents, and moms. Someone needs to talk to dads. As a single dad of 2 girls,
there we go.
This is something that I will know even less about than a single mother of girls. So I kind of think that the education needs to be skewed a little bit more to those who know less.
Yeah.
Look, in my opinion, the education should be in every single high school. So my plan is to start with the 5 big high schools in Pretoria, and just get it off the ground, and then continue and see how we can go everywhere and make and create awareness.
So you say that parents, mothers and dads, must write an exam when they know they're getting children?
No.
I'm going to park it there.
Okay.
Yeah.
I don't have kids, Aubrey, but I pick up on things, and then I have hypotheses.
And advice.
And
thoughts
helpful
and opinions.
I have thoughts and opinions. But I'm going to park it there and think about it. Now, because what you're saying and what you're all saying is, for me, sitting here, you've got girls, you're a woman, and I'm dumbfounded that there is such a lack of understanding of something that is inherent to womanhood.
Okay, can I explain it to you though? Because as a woman, if my mother, my grandmother, whatever, have also all had very heavy periods, and they've also all been struggling, you are then told, this is normal, this is what women go through. So your mother, your grandmother didn't go to the gynae to go and have a look and check out what is happening. So you literally go, well, it's in the family, that's what we do. So
it's normalized.
It's normal.
And Dr. Aubrey is saying it doesn't have to be that
Exactly.
painful.
No, it shouldn't. But it's also a modern disease, because most probably her grandmother didn't have endometriosis; she had something else. Because this is a modern disease.
So coming back to Miss X here, young lady, big dreams. You've seen, we've presented you with her story, and what is your take on it?
So she came to see me with her grandmother, and now she sits there and she says, "Listen, I can't do my job.
Shame,
I can't.
baby.
Some days I just can't get out of bed. I can't do what I need to do. I'm in so much pain. What can you please help?" And to just put it into perspective, anything that stretches an organ causes pain. So the normal size of an ovary is 2.5 by 2.5 centimeters.
Okay.
She has an endometriosis cyst on each ovary, which is about 12 centimeters each. That's just the endometriosis in her ovaries.
That's debilitating.
Then we have the endometriosis that she has on her bowel. Then I can promise you that if you put the camera inside there, the rest of her pelvis is going to be full of endometriosis as well. So it's going to be. I always tell the patients it looks as if you were in Gaza. There was some sort of explosion
IUD
there.
inside your body.
That is unbelievable. And she's just been trying to work through.
Thank you.
She's
just sucking it up, trying to get
work
through.
What is so that's how can it be treated? Is it an expensive exercise?
So there are two aspects to the surgery. Number one, it has to be done via laparoscopy, so that means we don't cut open these patients because you can't see. The disease is behind the uterus. You can't see. I have a nice, beautiful 34-inch screen, and the only thing that's in the way of what I see are 3 5mm instruments, as opposed to open surgery where you have the surgeon and the assistant's 4 hands in there, so you can see it so much better. Secondly, it's an ovary. So the endometriosis destroys the ovaries, which makes the egg, which prevents her from having kids. So the way that we have to manage the ovaries are crucial. So we have to treat the ovaries very respectfully, to keep in mind that one day she would like to have kids. And people are taught that if the ovary reaches 7 centimeters, you must take out the ovary because it can be cancer. No, it's not cancer, it's endometriosis. We must protect the fertility. So what we're going to do is I said there's just no ways, we need to help this girl. We're going to do a laparoscopy, and we are going to surgically sort out all the endometriosis. That means removing all the endometriosis, removing the endometriosis from the ovaries, removing part of the bowel, restoring everything back to where it's supposed to be.
Can I ask, Doc, does endometriosis come back though? Is it a recurring...
It's a chronic disease. The recurrence depends on various factors, because firstly, we don't know why people get endometriosis, and secondly, we can't predict whose endometriosis comes back and how fast it comes back. But the better the surgery, the longer the recurrence. We know that if you burn endometriosis, 75% will be back in 12 months. If you cut it out, 19% will be back in 5 years.
Oh, wow.
Sure.
Okay.
So you need to be in good hands. And Miss X, I get this. I suspect you're in very, very good hands this morning. On the line once again, our angel, one of our angels this morning, is Maria Pavli from Lotto Star. Maria, you've been listening to this conversation, and I think you're going to agree with me that Miss X is now in very good hands with Dr. Aubrey this morning.
Hi, Martin. Thanks for having me back. 100%. And I think a huge thanks needs to go to Dr. Aubrey and to our medical teams in South Africa. The work that you do is honestly incredible. And we thank you for taking on this case to restore a pain-free life to a 26-year-old girl. And in doing that, also maintaining her fertility. It's incredible, and we can't thank you enough.
How are you going to assist? You're an angel this morning. You've been an angel before. You're an angel once again.
Before Megan, before she tells us how she's going to assist, can I tell you what we're going to do?
Okay.
So, I'm going to operate the patient for free. My assistant has said she will assist for free.
Oh, wow.
The anesthetist said the anesthetist will do the anesthetic for free.
Oh, my goodness.
Oh.
The companies have come to the party. The company sponsoring the staples that we will need for the bowel. That's really expensive equipment from Purple Surgical. Monique said they will donate the staples for us for free. Wow. The company that's giving us the instruments that we use is donating that to us for the surgery as well.
Oh my goodness.
Sure.
So I've tried to get everyone in the team to contribute. So except for the hospital expenses and the hospital stay, from our side, we're doing everything for her.
That's incredible.
For free.
That is incredible. Dr. Aubrey, thank you very much for that.
You.
And good job for getting the great deals out of those people. Maria, this is how the angels get together. This is just the spirit of Good Morning Angels. There are hospital costs, I'm sure other costs as well. So how can you help out this morning?
So I think just to that point, you see there are multiple angels in every single story.
Yeah.
And like I said, we cannot thank you enough. Without you, we couldn't be assisting in any way. But for this particular story, for the hospital costs, we would like to donate 100,000 Rand from Lotto Star.
Sure.
Wow.
Miss X, let me tell you something. The angels are coming together this morning for you. You are going to live your dream pain-free, I'm sure, because you're in great hands. You don't have to be living the way you do. Thank you very much, Maria Pavli and Lotto Star, once again for being an angel. I'm speaking to you again a bit later.
I'll catch you again in a bit, Martin.
You can just move in.
Yeah, basically.
When you're on air and lots of stars on air, magic happens. Thank you so much, Maria. Much appreciated.
Thank you.
Dr. Aubrey, I thank you very much. I know you've done an enormous job getting all your assistants and suppliers, all those key role players together to make a difference in Miss X's life. And you've actually shared, I actually want to suggest that we put this up on podcast on demand.
Thank you. It is vital. It is absolutely vital for women out there to hear and know you don't have to live like this.
Because you can go from school to school, but our platform, especially our audio on demand platform, share it on school groups, WhatsApp groups and stuff. You've said such important things. Bye, dankie, lekker om jou te ontmoet.
It's a pleasure. Can I offer something else, seeing that we're busy with Good Morning Angels?
Oh. Yes, sir.
So if anyone phones into Jacaranda and you feel this is someone in need of this, as the Senior Medical Director of Genesis Reproductive Center, I would like to offer a person a free IVF, which will include consultations, which will include the medication, which will include the laboratory fees. So someone that phones in, you guys can decide who you think is needy of this and requires that. I would like to offer that.
That is amazing.
To someone.
The gift of a child.
The gift of a child.
Wow.
Sure. This got real. Dr. Aubrey, thank you very much. Good job, Angel. Good job.
Breakfast with Martin Bester, driving you to work every weekday from 6 to 9 a.m.